Yeah. I like it when someone has the same name. It makes me feel like this conversation may go well. Anyway, I'm calling because I had some complaints about Andy from the other Port Orchard Clinic.
Okay.
First of all, this started a couple months ago when I had a dental appointment, and my teeth were in really bad shape. And the first time they did the cleaning, they divided them in four parts,
Yeah,
and
blood scaling.
yeah, and the first time it caused me a lot of pain. So I asked them the second time if they could give me anything for pain, and they said no. So they gave me ibuprofen. Well, I only took a couple of them. It caused me to start bleeding, and I mean, I made an appointment with Dr. Tan about that because it went on for weeks. It ended up going on for like almost 2 months.
Yikes. Okay.
And so Dr. Tan, I make an appointment with him, and the day of the appointment, I'm leaving to go, and I talked to someone, and or I called the office for some reason. Anyway, I'm told that my appointment had been changed. And I'm like, oh no, nobody called me. Nobody talked to me about it. And they're like, oh, well, we talked to your mom. And I'm like, oh, well, you have no right to talk to my mom, and it's not her job to give me messages. So I drove in anyway, and they would not see me. They had switched my appointment with somebody else. So I got very angry.
They confused you with somebody else, or
They gave my
they had
appointment time to another patient. And then scheduled me for a different time that day. And then they called my mother and told my mom that they were changing my appointment time. Now, I never
okay.
gave them permission to speak to my mom, so right there, that was a violation. They had no right to talk to my mom about my appointments. She didn't even know I had an appointment. It's none of her
Right.
business. And then to switch my appointment with another patient, well, when I get there, I mean, I was kind of ticked off, and I did videotape the whole thing. I got the secretary totally denying that they switched my appointment. And then Andy came out, and she's just like completely denying it, said that she was the one who actually talked to my mom. And I'm like, well, you had no right to do that. And I have all that on videotape on my phone. So then of course, I didn't get seen that day, so I come back when they rescheduled me, and I see Dr. Tan. I told him I didn't want to see Danielle anymore. That's part of it too. Andy was involved in that. I talked to her and told her I didn't want to see Danielle anymore. I wanted to see Dr. Tan. So when I finally get in to see Dr. Tan, there's this young uh, boy. Well, I mean, I'm 52. I'm sure he was not a boy. He was in his 20s, but
Lucky you.
yeah, exactly. So anyway, he was really nice and everything. And this is the first time I'd met him, and he takes me back to the room, and he's just. I was kind of still mad, and I'm like, this really sucks. You guys took my appointment and changed it and gave it to somebody else. And like I said, I have Andy and the gal at the front desk with the glasses, the main receptionist that sits when you first come in, both of them denying it. And yet the male nurse is sitting there apologizing when I brought it up. He's like, "Oh, I'm so sorry. Yeah, we switched it. This other patient had a problem, and it was the only time that they could come in." And I'm like, "Well, I'm really sorry, but that's what they make an emergency room for. If I had tried to pull that, I would have been told to go to an emergency room. But yet you guys just switched my appointment with another patient." And he's like, "I'm so sorry. I'm so sorry." That's right. He was the one that talked to my mom, because then he starts apologizing for talking to my mom, saying that he shouldn't have done it, that he just had a new baby, and maybe he had sleep deprivation and wasn't thinking, and that's why he did it. I'm
Okay.
like, okay, whatever. He was obviously trying to make me feel sorry for him, and he was apologizing left and right, and it worked. Anyway, so then I during the time I had gone into the emergency room for the bleeding when I wasn't able to see Dr. Tan that one day, they had given me 12 tramadol. Now, I've been perfectly honest with my doctor, with Dr. Tan and with Danielle all along, and told them that I used to have a problem with painkillers, that I had a doctor over 11 years ago when I was in a really bad car accident, and she didn't send me for any x-rays, nothing. All she did was give me oxycodone for 5 years and then cut me off like cold turkey when I was taking 200 a month. And I almost died. I should have been on methadone, according to my pharmacist. I should have been on a step down program or something. But I laid around flopping like a fish, dying, not knowing what was happening to me. Went to the emergency room over 50 times in 1 month, and they wouldn't even tell me. All the only thing they would say is, we're not your doctor. We're just a band aid. And it's like, if somebody could have been honest with me, I'm an intelligent person. I have a very high IQ. I would have been able to figure it out and help myself. So since then, I've gotten myself off everything. I've saved my own life. I lost 60 pounds. I've gotten off of the 14, 15 different prescriptions that I was on. I don't take anything. And I've been very honest about it, that I don't ever want to be, addicted or anything like that. And I told Dr. Tan, I says, that tramadol, I says, when I was on the oxycodone, one time somebody gave me tramadol and I threw it away because I thought they were trying to trick me. I thought it was a sugar pill because I was on so many different drugs at the time. It didn't affect my body at all. And I literally thought they were trying to trick me. But since I'm totally clean and I'm not on anything, then when they gave me this tramadol at the emergency room here a couple months ago, I took one night. I slept for like 5, 6 hours. My stomach didn't bother me. I didn't get up and pee every hour. I didn't sit there twitching for 5, 6 hours before I got to sleep. I mean, I went right to sleep and slept for 5, 6 hours. I haven't done that since I was in my 20s. I mean, it was wonderful. So he gave me 30 of them. And I tell you what, in the 6 weeks between what they gave me at the hospital and the 30 he gave me, I took one at bedtime. So they lasted me for 6 weeks. It changed my life. I mean, it helped with my anxiety, it helped with my stomach, helped with my sleeping, helped with my pain. I mean, it just changed my life. I became such a more pleasant, happy person. I was getting things done in my life. I mean, it was unbelievable. Even my mom and my son, kept saying how nice and pleasant everything was and how happy I seemed. I was smiling and everything. Well, I told Dr. Tan this, and he won't give me any more. And I'm like, this is not cool. I'm 52 years old. I have steel pins in my leg. The pins are going out. I have so many things wrong as far as pain. And Dr. Tan, the way the insurance companies are set up now with all the changes, apparently I have to be seen for each and every little thing wrong with me. I have to go to a different specialist for each and everything wrong. Like my rotator cuffs were ripped out and the tendons, all three tendons on both sides were ripped out, right? So I see this orthopedic surgeon. My elbows are ripped out too, and my wrists, because when I was thrown out the car, I tried to grab the bumper as I'm being thrown out the back hatch. It was a rollover, end over end. I was torn up real bad. Anyway, when I went to see the orthopedic surgeon for my shoulder, I asked him about my elbow and my wrist, and he's like, "Oh no, I can only deal with the shoulder." It's like I had to go to three different freaking doctors just to get one arm taken care of. The way the system's set up, it's ridiculous. I understand what Dr. Tan's dealing with. But like I told him, I said, "You're my doctor. You should have the last word, the final say. I don't care what the clinic says. You're the doctor. You know what my issues are. You're responsible for my care. And if you feel that I need this medication, you should be able to override the clinic and give it to me." And I taped it all. And he just scooted out of the room and wouldn't say anything and just kept saying, well, all he'd say is, "Nope, nope, I can't. The clinic won't let me. I can't, I can't." So I'm in there and I'm finishing up, and I'm talking to my son. The door was closed and Andy comes bursting into the room. "You can't be videotaping." I'm like, "Lady, you can't be walking in my room without knocking, number one. Number two, my son and I are talking to each other and we're just videotaping each other. I did not videotape Dr. Tan. His voice is on the video, but I never, ever pointed it at him. My son was holding the phone down to the floor, made sure that nobody's faces were ever seen. It's only voices, and it's for my personal thing because I have a YouTube channel and I'm writing books and whatnot. So, of course, she freaked out, and we need to do something about this situation. Number one, Dr. Tan told me in my last appointment he was going to send me to a pain specialist. I've called twice now and I still haven't gotten that referral. Number two, if there was any decency in this situation, he should have offered to at least give me enough of the tramadol to get me through until y'all could get me an appointment with this pain specialist. That would have been common sense and human decency.
Okay.
I haven't slept since Saturday. That was when I ran out. I had like when I my appointment was last Tuesday, I believe. And I had enough to get me through like 2 more days, but I haven't slept in like 5 days. I've literally made videos about it. It's like horrible. The first video I made a couple days ago was tramadol kills more people than heroin. It's a joke because tramadol is nothing but a glorified aspirin. They sell it over the counter in Canada. I've been checking. If I had $100, I can get a Canadian pharmacy to send me some, but I don't have no money. And it's ridiculous that I should have to go to the streets or do things illegally through the mail just to be able to deal with this situation because my doctor won't help me. I mean, one simple tramadol at bedtime just changed my life. I don't understand what the problem is.
Well, and what's odd is I don't know. I'm still trying to understand too why he would have started the medication, or was
Uh,
he just trying it for an
because I
excuse?
was
Or
bleeding so much that I
oh
can't
right,
take a
so take
leave or the
ibuprofen.
ibuprofen or anything. And
Okay,
since
so he
then,
started giving it to you because of the teeth thing and getting your teeth clean.
yeah, that's right. And
Okay.
then, yeah,
It's like so, our policy in general is, we can use medications for acute pain, but we're not supposed to continue to prescribe it chronically. And that's why he's trying to get you to a pain specialist who could continue to prescribe chronically. But, the beginning of it all was to address your acute tooth issue, if that
yeah.
makes sense. And then now the tooth issue is over, so
And the
that's why.
bleeding since then because I can't take ibuprofen or Aleve anymore. I've been to the digestive health specialist that he sent me to, and the digestive health specialist found that I have what's called an anal tear. So I have to go and get this special compounded cream thing, and then he has me on a special no dairy. I have to cut all the dairy out of my diet. Well, this is going to take time to see if those things will help so that I can take Aleve and ibuprofen again. But even those two things didn't help. That's the thing. When they gave me this tramadol, I realized what a miracle it caused in my life. I mean, it helped so much. And that's why I don't understand why can't Dr. Tan just do it one more prescription for 30, and in that time I should be able to get in to see the pain specialist and then he won't have to deal with it anymore.
Well, I think there's a lot of layers to this.
Yeah.
And part of it is, you know, just some of the other stuff that's been going on. Like people videotaping appointments is pretty weird.
Well, I've had a lot of issues. Like I said, that one doctor who got me on the oxycodone in the first place she was a pretty evil person and she shouldn't even be practicing medicine. And she started treating me really horribly, so that's when I started bringing a tape recorder in my knitting bag because of that. I just don't I have a lack of trust for any of you guys anymore.
I
Uh
can understand that.
when I moved over here 2 years ago, I started seeing a doctor in Point Fostech, and her name is Kara Scanlon, and she's for Providence at Point Fostech. And I'm also a surviving victim of the Green River Killer. I was all over the TV stations here almost 6 years ago when they arraigned Gary Ridgway on his 49th murder. I came over from Spokane, and every news station in Seattle was at the train to meet me. In fact, I'm looking at my Seattle Times news story that they did in the Seattle Times about me. It's sitting right here. Anyway, and I was also kidnapped when I was 13 years old by four men from a kegger who drugged me and took me home for sex. They were going to kill me and bury me in the backyard. Fortunately, they ran out of beer and I escaped. These are just a few of my stories. I'm writing a 4-book series about it. My book's called Damaged Goods. My YouTube channel is called Damaged Goods. Anyway, when I went to see this Kara Scanlon 2 years ago, I told her about these issues. And I said, Kara, sometimes I have bad days. And if I seem to have a bad day where I'm getting a little tiffy or whatever, just say, hey, Jennifer, snap your finger, we'll have a little code or something. And then it'll bring me back, and I'll be okay. And the first appointment went great. Well, like the third appointment, I was a little bit late and I called in to see if they'd still see me. I'm on hold for like 20 minutes. All I said when they answered the phone was, wow, I could have been there in the amount of time I just sat on hold. I said it exactly in the same tone I just said it to you. The receptionist hung up on me. A couple minutes later, my phone rings. I answer it. I say hello. The caller says, hi, this is Kara Scanlon. I'm like, oh, I'm thinking my doctor's calling me to tell me, come on in. It's cool. Oh, no, was I wrong? She's like, you know what? I'm here to tell you that you are a horrible person and you deserve everything that's ever happened to you, and I don't want you as a patient anymore. And she hung up on me. I almost committed suicide that night.
Wow.
So I have a big mistrust.
Yeah, it sounds like you do, and it sounds like you have reasons to, but I'm sure you can kind of understand too on the other side of it. It doesn't create like exactly a therapeutic relationship with our providers, when you bring them to the table and then you tell them you're recording them. You know what I mean?
Yeah, I do. I don't know what else to do. I'm in such a. I mean, if he would just agree to give me a little bit more until I can get in to see this pain specialist, I mean, it changed my life. When a person, it's like I'm trying to tell him when I haven't slept in days, and then the mind starts not working well, and then it just gets worse and compounds more and more and more. I mean, I can't even think straight at this point. I just now got up because I realized I'm wasting my time trying to sleep. I can't sleep. I haven't slept in days, so every day it's like, just get up. Maybe tonight you'll be tired enough to go to sleep. No, the anxiety, I sit there twitching. I don't know if I have restless leg syndrome. I don't know if it's anxiety. I don't know. But I tell you what, that tramadol helped with my pain, my sleeping, my stomach, everything. It's like, I don't understand why there can be no common sense in this situation. Why everybody's so worried about, well, the DEA put it on the hardcore list now, and the clinic has this rule, this that. Talk about layers, the right hand telling the left hand what to do when the backhand doesn't know what the front hand's doing, and it's ridiculous. Our system is so messed up. I mean, everybody can agree on that. I understand you guys don't want to be sued. You don't want to create a drug addict. You want to follow your clinic rules. But can there be some common sense somewhere in this situation? I mean, if he would even, I talked to this Andy like 2 days ago, 3 days ago. She promised me she was going to get my insurance straightened out because apparently you only have one pain specialist in Bremerton who can't see with my insurance. They have to switch it to something else, or I have to go to Tacoma, and I'm like, I don't have a car. So she was supposed to switch it and call me right back and get me an appointment in there. That should be done already. And if that had been done, I mean, he could just give me like the hospital did, 12 lousy tramadol till I get to my appointment. I mean, my God, what? I don't understand. Why can't I do this? What's the problem?
Let's see. So, actually, you have to change your insurance. There's nothing we can do.
Oh my God, she told me she was going to do that. I literally have her on the videotape called I am the world's most hated woman ever. If you look that up, you will see where she said she was going to do that.
Well,
Wow. Wow.
she said
Awesome.
she was going to check about switching insurance.
No, she said she was going to do that. That she could get that done.
That she was going to check about it. I'm just reading your
No, she said
here
she
to
was
make
going to
the
get it
GI would
changed.
not be affected because they didn't want to change your insurance and then all of a sudden you can't see your GI specialist that you're in the middle of seeing.
Yeah,
So,
she did mention that, but she said she would get it taken care of and get back to me. And she hasn't even called me back. So, I mean, really, if you're sitting there looking at whatever it is she did, why didn't she call and
it
tell
was
me?
the notes from a couple days ago. You said
So,
she
why
called
didn't
her.
she call and tell me that?
Let's see if there's any updated notes.
She seems a little young and inexperienced to even be in the position that she's in. It's like, how in the heck did she even get that job? And that's what patients are having to deal with. I mean, when she shouldn't even be in the position she's in the first place, how does that promote confidence in your patients? And every time I go into that clinic, I sit there and listen to people complaining every single time. Usually it's about the fact that they have to sit there and wait for over an hour to even be seen every time they come in for an appointment. I've seen dozens of people in there complaining about that. And my son's a patient too, so he's seen it all too. In fact, my son says that he gets treated way better than I do. Dr. Tan's his doctor, and the last two times when he's come in with me, he said, Mom, I totally get what you're talking about because Dr. Tan, he talks way different to me and he's way nicer to me, but he acts like he's scared of you or just don't like you. I'm like, yeah, I know. I get that a lot. Hence
Well,
the why I'm the most hated woman in the world. That's why I
I
named
don't
the
think you're
video.
the most hated woman in the world.
That's why I named the video that. Well, according to my ex-husband, I am.
Besides your ex, okay. Um,
Yeah, I just left my ex-husband of 30 years because he was so abusive. So, yeah, I was kind of like a prisoner. I lived in a cabin he built out of tree branches and Walmart bags, and I had no power. I had no running water for over 7 years. I had to use a bucket to do my business. When it's 17 degrees below zero and there's 5 foot of snow on the ground, that really sucks, let me tell you.
I can't imagine. I
Yeah,
wouldn't
he
even
left me
attempt.
there with no car, no nothing. And he lived in Spokane in a pretty nice house. He'd just show up every 2 weeks and give me and our son some food and take us to the gas station for a shower. I lived that way for years and I wasn't smart enough to leave.
Hmm. Well, I'm trying to figure out what I can do for you right now. I mean, I can't make a provider prescribe something, you know.
Well, I'd appreciate it, but maybe somebody could go and talk to him and mention what I did. Like my son and I said, he was so busy trying to scooch out of the room, he wasn't even listening to anything I said. He wasn't even trying to think of an alternative or come to a mutual agreement or anything. And it's like, really, Dr. Chan, you can't even come up with a solution yourself. Like, hey, I'll give you a couple more and I won't give you any more. You have to go to the pain specialist. Really? He couldn't have just done that?
What I'm thinking is that some of the other things have broken down in the communication.
Well, I'll tell you what, if he agrees to try and work with me and agrees to give me a couple to get me through till the pain specialist, I'll agree to never ever videotape anything ever again. I'll even sign an agreement saying if I do, you can fire me as a patient.
Well, I mean, it's not like we're gonna know whether you are or aren't.
Well, I went out of my way to kind of make it clear. In fact, if you ask Dr. Tan, I'm sure he'll admit that he saw the phone in my son's hand the whole dang time. Nobody even tried to hide it. He didn't even try to hide it. He didn't. In fact, Dr. Tan actually even made a comment about him being on the phone when he walked in the room. I think Nick might have played it off like he was playing a game or something, but
Yeah, and certainly, I mean, it's not unusual for people to be on their phone necessarily.
I won't even bring the phone in the room.
Yeah. Um,
I don't bring my knitting bags, and I don't carry a purse anymore either, so it'd pretty much be pretty easy to see that I don't have anything. And like I said, I also have a YouTube channel, so if it ever came up, if I signed an agreement, I also could pass the bar for a law degree right now. I read RCW codes just for fun. I've literally had to tell judges what the law is because even they don't seem to know. But I also know that if I signed an agreement saying that I wouldn't do that, and you ever came across a video or any patient saying that I had, you could sue the crap out of me. I could probably go to jail.
um, well, and the other thing I can do, at least for right now, is follow up with Andy on where things are with the insurance and referral.
Yeah, I'd appreciate that, but I really would appreciate you talking to Dr. Tan to see if we can't get something called in to at least get me through for a week or so till I can get in to see these specialists. I really need to, get some relief from my pain and be able to sleep and my anxiety and everything else that it helped with. I mean, 12 lousy pills, I would agree that, to whatever you want until I can get into the specialist.
I highly, highly doubt that's gonna happen, but I mean, I can talk to him if you want me to.
I'd appreciate it. And I'll agree not to post this video that I'm doing right now until I hear back
But
from
you
you.
can also see how, this conversation is a little bit like,
What do you think people watching the video will say? Do you think they'll agree with you or me?
I don't know. It's hard
Well,
to
we'll
say,
let the
but at the
audience
same time,
decide that. I will not post this video for 1 hour. I will give you a time to talk to
yeah,
Dr.
but
Tan and
you're
get back to
if
me. And
you're
if I
making
hear
this
from you by 2
situation
o'clock,
and use it like it's blackmail to get what's actually a controlled substance, you see where I'm going with that?
well, I kind of dare you to do anything about it because I would love for anyone to even try to. See, I'm also trying to get my license to grow marijuana with the Liquor Control Board, and I taped them last night. And in fact, you can watch that video. Just put in the YouTube thing, put in damaged goods, and then the title of my video is called Screwed in the Butt by the WSLCB. And you will see where she says, "You can't tape me. That's against the law." And my response to her, which is exactly what it is to you, "I don't care. I dare you to do anything about it because then you'll give me the audience that I need. Then it'll go viral. Then it'll be on Nightline. Go ahead. Make my day, honey. Now, I will give you till 2 o'clock to work some kind of solution out that's acceptable to me and Dr. Dan, or this video will be posted. Have a nice day." So that's where I've left that with her. I'm sick and tired of their fucking crap. They want to go to war? Let's go to war. Try and prosecute me. Prosecute me, motherfuckers. I fucking dare you. I will sit in jail. I'll go on a hunger strike. I won't eat. I will let myself perish if that's what needs to happen. I will be the martyr that will fucking rip this stupid situation right the fuck out so everybody can see what's happening because it's bullshit. The people need to be in control of this country again, not the fucking politicians and the biased ass news media and the stupid fucking doctors who won't even fight for their patients anymore. Fuck you all.